Carol,
Yes,
this is, see on a chat that from Jennifer that says
I
she's here.
do. I
My
do.
microphone, yeah, okay,
Thank you.
you're welcome.
Okay, I believe it's officially 2 o'clock, so let's begin. I'm Carol Bragdon and serve as the chair of the APRN Committee of the Kansas State Board of Nursing. I ask the members of the committee to respond to a roll call signifying their presence at this open meeting that is held by Zoom and YouTube. Please say yes or respond verbally to me. Patsy Zeller,
Yes, I'm here.
Jennifer,
I'm here.
thank you. Glad you can hear, you can talk.
Yes, thank you.
Ben Cochran,
Yes, I'm here.
Bobby Mansfield,
I'm here.
Jamie Harrington. Well, we had Jamie, maybe we've lost her. Dawn Gosnell,
Yes, present.
thank you, Dawn. And I believe we also have Adri Goldsmith. She is a new member of our board, Kansas State Board of Nursing. So welcome, Adri. We're glad you're here with us today.
Thank
I
you.
also ask the following board staff members to signify their attendance. Carol Moreland, Executive Administrator,
Here.
and Jill Simons, Executive Assistant.
Here,
Public comment allows individuals to address the APRN committee about their concerns, but the Kansas Open Meetings Act, or COMA, does not require the APRN committee to provide public comment or answer questions from individuals. As we will not know what comments an individual may make, we would want to provide public notice to the public of our intent to discuss a particular matter so the public may listen and observe our discussion. Public comment will not be taken today due to that concern and because this is a meeting conducted by conference call where the connection may be lost over time and a period for the meeting may not allow everyone who is present to comment. Because we are conducting this public meeting remotely by Zoom and YouTube, I state for the record the following information. On August 27th, 2020, the board sent notice of the meeting for the APRN committee to all individuals who have requested notice of the committee's meetings. Additionally, the notice and agenda were posted on the board's website, ksbn.kansas.gov. You may obtain a copy of the notice and agenda at that website or by sending an email to carol.moreland@ks.gov with the subject line, request for the agenda, and the board staff will send it to you. The notice also advises individuals to contact the board office at 785-296-2967 if they experience technical difficulties during the meeting. Number 2, the notice contains the link and password for Zoom and the link for YouTube that allow the public to attend this meeting free of charge. The notice also advises individuals to contact the board office at 785-296-2967 if an individual experiences technical issue during the meeting. Number 3, effective June 9th, 2020, the House Bill 2016 ratified Governor Kelly's emergency declaration due to the COVID-19 pandemic and extended it through September 15th. 2020. On September 11th, 2020, the State Finance Council extended the emergency declaration to October 15th, 2020. However, the requirements of COMA were not suspended. We will be conducting this meeting pursuant to COMA and KAR 16-20-1 concerning the compliance with COMA during an emergency declaration. Number 4, the connections to Zoom and YouTube are the only mediums for interactive communication offered for this meeting. Number 5, each member of the committee, board, staff, or presenter shall state the person's name and title each time the person speaks or votes, as the case may be. Each participant to this meeting shall ensure microphones, phones, or other electronic devices are on mute when the participant is not speaking. Number 7, each motion shall be clearly stated before the committee votes, and the chair will announce the results of the final vote. And 8, statement or motion will be clearly identified and authorized by delegation. Each member of the committee or staff will be permitted to sign any document on behalf of the board. Number 9, the meeting is being recorded and the recording will be posted to the board's website. The committee has the following items listed on the agenda: call to order, review of on-site packet, additions or revisions to the agenda, announcements, approval of meetings for the meeting held in June 2020, unfinished business, new business, agenda for the committee meeting 2020, and adjournment. This meeting is now called to order, and the committee will now consider the next item on its agenda. On-site packet, I believe there is nothing for
Correct.
that.
There is no on-site.
Good. Are there any additions or revisions to the agenda? Hearing none, the agenda will stand as published. Announcements. I don't believe I have any announcements. Carol, do you have anything?
No, I do not. No.
Okay. Approval of minutes of June 16th, 2020. You'll take 1 second and look at those in the packets here. Any additions or corrections to the minutes of June 16th? Okay, hearing none. Jill, do you have a motion for us?
I think Jill is frozen, so I'm working with her.
Oh dear.
The fun of,
Let me read the motion here. I guess we have to approve the agenda as well. I move to approve the agenda as amended. May I have a second?
I will second.
Thank you, Bobby. All in favor of approving the agenda, say yes.
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 Carol, this is Jill.
Motion
I
passed.
apologize. My
Good.
system kicked me out, but I'm back.
Okay, all right. We're ready to approve the minutes if you want to read that motion.
Yes, I will read that. The motion reads, I move to approve the minutes from the June 16th, 2020 APR committee meeting as written.
Okay, and may I have a second?
Second.
All in favor, say yes.
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 Any opposed? Motion carries. Okay.
Who's actually going to make the motion though? I mean, I read it, but someone needs to make the initial motion.
Oh, I made the motion. Thank
Okay, thank you.
you. I was a little unclear on my wordiness. Okay. Unfinished business. First item listed is prescription monitoring program. Bobby, we'll turn it over to you for your report.
Okay, thank you, Carol. The Board of Pharmacy Prescription Monitoring Advisory Committee continues to meet on a regular basis virtually like everybody else. The last meeting was August the 28th. Typically during that meeting, there are updates about how the program is being managed. They have some grants that have been very helpful for enhancing the work and just spreading its availability. Then there is an executive session. The advisory committee is asked typically to review 2 to 3 cases where data collected by the K-TRACS program suggests that there might be some patterns of concern. Those patterns can involve patients, prescribers, or pharmacies. Most of the time, they are patient patterns of concern where there have been, in a 90-day period, there's a benchmark where a patient has been to 5 or more prescribers or 3 or more pharmacies or had 11 prescriptions for controlled substances. And that benchmark pattern has to be repeated over at least 3 90-day periods of time. So there are particular criteria used to identify patients who may be putting themselves at risk. And that's one of the important roles of the advisory committee. So those cases are reviewed and recommendations are made. At the last meeting, we also agreed that the criteria that had been developed are serving us well. We are still novices in making recommendations and then getting feedback about how helpful those have been. And oftentimes the recommendations are to notify the prescribers involved that there's a patient who may be putting themselves in an unsafe situation. We may encourage prescribers to either activate their KTRAX account or use their KTRAX account, because knowledge is the important thing. It's a great tool. And if prescribers are not using it, they're missing a lot of important information. So we have a meeting planned in October, again in December. Those typically are 3-hour meetings with that kind of pattern repeated at the meetings. So thank you for the opportunity to represent the Kansas State Board of Nursing. Our voice is respected. I missed the in-person meetings because I think there was more networking that could happen. I'm sure we all feel that way. I miss this one being in person. So even though I never was sure I would find the room or get off on the right floor. Okay, thank you so much.
Thank you,
Madam
Bobby.
Chair,
Yes, Carol.
if I might just kind of update you a little bit about KTRAX and the funding.
Yes, please.
I'm sure you kind of want to hear about that.
Oh, yes.
Just for everybody else on the committee, funding KTRAX has, for a number of years now, for several years, has kind of been an issue because it was started up with grants and stuff like that, and that has worn out for the most part. And then it kind of came back onto the licensing boards that had licensees that were able to prescribe. And we were kind of charged for part of the funding of KTRAX by the number of licensees that we have that can prescribe. Because of course, now the licensing boards that we were talking about was the Board of Healing Arts, Nursing, Dental Board, Optometry Board, and then of course the Board of Pharmacy. So those were the main 5 licensing boards that helped funded it. And there was a lot of discussion last year in the legislature over there because these licensing boards feel very strongly that it should not fall back on the boards that license the prescribers, that there really should be something coming out of state general fund to help fund this project, because it is truly important and it really needs to be seen as that. However, there was a lot of discussion last year in the legislature about how to fund this going forward, because there was some frustration that, you know, it started with grants and stuff like that, but there was no plan, long-term plan about how this was going to be funded. And then when the grants ran out, then these licensing boards were coming back to the legislature and saying, okay, this program's up and running. It's a great program, but you need to find some way to fund it. And they're like, you know, this should have been started from the very beginning. So it kind of went back and forth over there during this legislative session. And just to kind of let you know, kind of over the years, what the Board of Nursing has paid, fiscal year 18, we paid $30,000. Fiscal year 19, we paid close to $37,000. Fiscal year 20, it went up to $72,000. Now, what they've been able to do for fiscal year 21, which is what we're in right now, is they've been able to tap into the drug rebate fund, and that's going to fund a lot of what the licensing boards did. So right now for this current fiscal year, we won't have anything taken out of our fee fund for this. However, beyond, you know, going into fiscal year 20 and 23, we had to figure out how to make this work. So the Board of Pharmacy, I think they made some kind of changes in K-Trax a little bit. And I don't know that I can really talk to all of those changes very well, but they've made some changes. So they've been able to bring the operating expenses down a little bit, which is good. But that's not going to cover everything. And so what they're recommending, the Board of Pharmacy actually took it to, I guess it's their board, their stakeholders, and said, can we just pay for all of it? It means we'll have to do licensing fee increases and all of that. They were not comfortable with the Board of Pharmacy absorbing all of this. They still wanted the two other top licensing boards to absorb some of the cost of this, of which the Board of Nursing is one of those. So what they're looking at for fiscal year 22 and fiscal year 23 is that pharmacy will pay like $213,000, and there's still an additional $9,000 for fiscal year that they're not sure where that's going to come from. And then for fiscal year 23, it would be like $16,000 that they're not really sure where that's going to come from. But then what they decided for the Board of Healing Arts is they would pay $75,000 each of those years, and the Board of Nursing would pay $70,000 both of those years. And that is no longer based on the number of prescribers that we license. It can't be, because we have like 6,900 APRNs, okay? So I did question as to why, because before we were paying like half of what the Board of Healing Arts did. So I kind of asked why we were so close now. And they said they felt since pharmacy was absorbing the majority of this, that it should be kind of equal among the other two as much as possible. So again, that will start in fiscal year 22 and 23 unless something else changes. But I don't look for the legislature to come up with money out of state general fund for this. My concern is, there still isn't this long-term solution for how this is going to be funded. It seems to go fiscal year. And the reason that we know about 22 and 23 is I just submitted our budget for fiscal year 21, 22, and 23. So we had to know this to put in the budget. So I think that's why we got some numbers for those two. Alexandria told me that it's not set in stone, those numbers, but I just wanted to update you on that because that's a little bit different than we knew in the past.
Well, Carol, that really helps me to hear from you directly. So what I'm hearing you say that you've budgeted for 22 and 23, was it 70,000 that you said?
That's what she's saying will have to come out of our fee fund. It's a transfer out of our fee fund is what it is. And for fiscal year 20, we paid 72,000. 72,000's been the most that it's been, but now it's falling back to 70,000. Yeah.
Well, I admit it's a crisis every fiscal year when they talk about how to fund K-Trax.
Yeah.
And Alexandria is always optimistic and energetic about presenting to the legislature the value of the program and how it should be funded out of general funds since it is a public health service used by professionals. So, and there's been traction. I do believe there are more that understand that perspective, but in a tight state budget future, I don't know how optimistic, but I'll be happy to be the squeaky wheel. It's interesting that we are being asked to carry a load similar to the Board of Healing Arts. I will tell you, when I started representing the Board of Nursing, everybody in that room referred to people who wrote prescriptions as physicians. And it's taken probably 2 years to get them to be generic and call us prescribers. So maybe I'll take credit for creating that equity that now is costing us more money. And we have to decide, was that battle worth it? But yes, it's very, very helpful to hear the pain that inflicts on the Kansas State Board of Nursing. So thank you.
You're welcome. Adrian actually went to a meeting or two about this for me because I couldn't go. So he might have a little bit more feedback about kind of what they're changing as far as services to maybe, cut the cost down a little bit. About that, Adrian, can you talk to that?
Yes, thank you. What I've seen is that it looks like the interconnect feature that they were going to provide, which essentially is, I think at the EHR and the integration solution looks like it's going to be cut back. And that was the more expensive portion of the licensing that was needed for the K-TRAC system. There's some thoughts that maybe they can do some sort of a fee for service for that particular portion if a organization or group wants to still utilize that. But that portion in particular was the biggest part of the solution. And then they did some other adjustments to like travel and that kind of stuff in there too. But that definitely was the biggest part.
Well, and I will say that from a prescriber's perspective, being able to have the K-TRACs integrated into your EHR is absolutely the way that makes this system work. So it'll be interesting to see. I'll be able to ask questions about that. But prescription monitoring programs are software programs. They are going to continue to develop new functionality and create costs with that. I don't know a software program that doesn't go up in price over time. So, it's kind of hard to keep costs under control as it is in medicine when you're talking about technology. But yeah, this is great information for me to carry back. I'll be happy to be the voice of fiscal pain.
And for the newer members, there was discussion about whether or not you could add a tax, so to speak, on prescriptions, or you can do it on the pharmacies, or whether or not it could be moved to the Department of Health and Environment. I mean, there's been various different things passed around for, gosh, what is it, about 2 years now, I think. They're working on a solution, and they continue to invite us to the table with all of their discussions, which is appreciated.
Mm-hmm.
Well, I thank you all for your great efforts, and particularly Bobby for representing us well, even if sometimes it is a double-edged sword. But no, I think the fact that we are now considered members of the table is worth more than we can otherwise state from a APRN perspective. So we express great appreciation for you doing that, Bobby, and keep up the good work. Next, any word on the CNM regulations, Carol?
Yeah, this is Carol Moreland, administrator, and I actually caught up with Tucker yesterday to just get an update before this.
Yeah.
And I can feel some of what the pain he's talking about in here. They went live with the applications for the CNMI about a month before COVID hit. And at this point, they only have one licensee, which they really feel like is not all that surprising considering the circumstances that are going on. There's just a lot of uncertainty in licensing boards right now between the pandemic and House Bill 2016. And, probably for the first 2 or 3 months of the pandemic, it seemed like every day, at least every week, something was changing as far as requirements for the licensing boards and different stuff like that. There was just another executive order put out last week that affects us. So it is kind of an uncertain time. The first group of regs went live in January 2020, and the remaining regs are still in the process. And I will just let you know that process did kind of stop when the pandemic, because there were so many people working remotely and all of that some of the things that didn't have to be what you would call critical just kind of didn't happen for a little bit, and they're starting to get up again. So it sounds like the remaining regs that have not been approved are still in this process. And I asked him about, the advisory council and bringing them back together. And the feedback he gave me is he doesn't feel like there's enough business to bring before the council because of the low licensing numbers, the COVID disruption, the House Bill 2016 uncertainty, and the remaining regs that were approved by the council, but are still held up in the process. So that's just kind of feedback from Tucker.
Hearing that, Carol, I'm not sure there's anything for the committee to particularly do other than thank you for following up with Tucker and trying to maintain a line of communication with the Board of Healing Arts. I think that's probably our biggest endeavor at this point in time, is just maintain that communication and follow, because as the statutes are currently written, the Kansas State Board of Nursing does have to somehow approve those regulations. So yeah, someday in the future, perhaps for that one provider, we'll have that done. I don't know. What a challenge. Thank you. Any other comments from the group regarding the CNMI? Let me also welcome another new board member. I see that Giovanni Gahn has appeared on screen. So welcome, another new board member. So we appreciate that. Next item is an update on 2412. Capon does have a new president now, Amy Seipel. She has been in communication with the board as well. I don't know that she's available for any communication with us today, but Carol, I'll let you give us a bit of an update from your perspective.
Yeah, I think Amy was going to join us. Colton, can you tell if Amy's around? She told me she was going to join by Zoom.
Yeah, I'm not seeing her.
It looked like she's listed in the attendees.
Okay. Okay.
Maybe there's a message. She says she's
I have
on.
unmuted them. They should be good to talk.
Okay,
Okay.
can you hear me now?
Oh, we can, Amy. Yay!
Wonderful, wonderful. Great, thank
Amy,
you so
would you
much.
like to give us a bit of an update that from your perspective on 2412? And we appreciate you attending the meeting today. Thank you.
Absolutely. First of all, I just want to thank the board. We are so thankful for the work that you do. And we must say that it is very important to us that we remain under your regulation and your regulation alone. So we're excited for the opportunity to bring forward a bill again this year, this legislative session. And we've got full support from NCSBN, AANP, and our lobbyist group. And we've talked to lots of legislators, and we feel like we've got strong support this year. So I will have to say too that our KNAP board will be meeting next week. We'll be voting on this, but I suspect that this will be essentially the same bill as last year with just a few clarifications and language recommended by NCSBN to be more consistent and uniform with other states. So that would be that those 4,000 hours or more of practice, for people who have that, they go straight to full practice authority. And for those who do not have the 4,000 hours, they would need to have that done within 3 years. We are also looking at clarifying language in the bill that does not prohibit APRNs from voluntarily entering into collaborative practice agreements. It only removes the mandate that they have as CPA. So again, our bill has full support of NCSBN, and we're thrilled that they chose Kansas to work with again. So they are providing lobbyists and they're helping promote this bill. Again, I just also want to say that the effective date of the bill after passage will be 1 year to allow KSBN time to get all the processes in order. APRNs will be required to join the Healthcare Stabilization Fund. So although we do have concerns about 4,000 hours, that is twice as many as most other states have. Our neighboring states, Colorado requires 750 hours for transition to practice, and Nebraska 2,000. So at this point, I will say that Both the lobbyists from NCSBN and the Heinz Group are recommending that we not try to push that number back at this point, but it might be something that we revisit a few years down the road and see what progress we can make. But at this point, we've got good response from our legislators. They know this bill. It's come out of committee twice, and we feel pretty good about it. Do you have any questions for me?
I'm not hearing any questions, Amy. Thank you. We appreciate the report and look forward to hearing you next time and on into next year. One thing I might just mention was that the APRN Compact was approved at the annual NCSBN meeting. So those of you who are interested may want to look at that document online through National Council, and I'm sure National Council will be apprising any of the states that are working on individual legislation. One thing to kind of keep in mind is, you know, the ultimate goal would to be having Kansas be able to participate in the compact. So we would not want any language that would, you know, be in conflict with that. So look, is that the right way to say it, Carol? At least for now, anyway, as a precursor.
Yeah, the practice hours in the APRN Compact are going to be 2080. So that will be, we were kind of hoping that the bill would just kind of be able to ease into the APRN Compact.
Correct.
If it's 4,000 hours.
Yeah, but I fully agree that we have to have something where we have some room for compromise, or we may lose support in the legislature, and that may be the price we have to pay at this point in time. And that's a minor consideration when you look at the larger picture and goal down the line. So anyway, we'll keep you apprised, and vice versa, as we learn a little more regarding those elements. Okay. Next in your packet is the rules, and we've just put that in there mostly for information regarding some language, I guess is the word I'm trying to say, for some rules and regs. You know, we'll have a year to get things developed and after legislation passes, but you know, I would like the committee to, you know, at least be thinking about some of the things they would like included in rules and regs, and this is at least some example language for that. Any other comments, Carol, for this at this time? Not sure we're hearing you, Carol. Unmute.
Sorry, I think this actually was on the December agenda, and then we didn't get around to it. We meet in March, and we didn't have time in June, so it's on there.
So it's really more informational than anything at this point in time. So there at least is some examples as we get ready to work on some things. Okay. Criteria for standard review for out-of-state programs.
You want me to address that?
Please go ahead. Yes.
Okay. On page 38 in your packet, you have our statute 651133 that talks about educational and training programs for advanced practice, approval and stuff like that. And I actually put this back on because I just have some questions about the way that we do it now. You're well aware that I bring a list of programs, out-of-state programs. Now, this doesn't have to do with in-state. This is out-of-state that we look at to see if they include in their curriculum 3 credit hours of advanced health assessment, 3 credit hours of advanced patho, 3 credit hours of pharmacology, that they have a minimum of 500 clinical hours in the specialty track, and that they're nationally nursing accredited. So this statute actually kind of addresses some of the out of state, and that's under number or small letter D there. The rest of this is actually in state. So I just kind of want to make you aware that we do sometimes have licensees who kind of, or I should not say licensees, applicants who get caught in the system that we have now. Such as, we have this list of programs that you have all looked at this data. And so we assume then that it has to be looked at every 10 years. I have a little concern about that because the program at any point in time can change the curriculum. So what we actually do for advanced practice when we have an applicant is we look at every one of their transcripts to make sure that they have those things. And what can happen the way that we do it now, when the information has to come to the APRN committee, if it's not been looked at, is it actually can force that applicant to not get licensed for almost 3 months. Such as, let me give you an example. Okay, we meet today, board meeting meets tomorrow. The board, you all and the board approve who are on the list now. Okay, we can go ahead and license those applicants. We could get an application on Thursday that is from a program out of state that we have not looked at. We are not meeting again until December. So the information has to come back to the APRN committee. And so what we have to tell that applicant is, okay, if you want to work before then, you're going to have to do a temp. They have to pay us for a temp. And they're like, well, you know, that's not really fair because of the way that you have it set up. And I can understand what they say. I see their side of it. I see our side though, too. I'm not saying that we're doing anything wrong. Please understand that. But I'm just trying to figure out if there's a way that this could work a little bit differently. If you look at D, it says the board may accept nationally accredited APRN programs if they meet our regulation. So I guess my question is, do they have to come back to this committee, or can we just check and make sure that they meet our requirements and that they are nationally accredited? I just wanted to have some discussion because we do get some very frustrated applicants if they have to sit and wait for 3 months because they don't want to get a temp.
Right.
And they're frustrated with us. Does that make sense to everybody?
It absolutely does. And we have had some concerned individuals that have been caught in exactly that bind that you described, Carol. And in all reality, a national accrediting agency has already done the review of that school, and they require the 3 Ps and appropriate clinical, and in fact, sometimes more than what we actually require. So I'm thinking this may be one of those things that we've done it this way because we've always done it this way. And in the past, numbers were small. There really weren't all of the issues that we have now. And as we move more towards independent practice, or full scope of practice, I should say, rather, I think this will exacerbate the need for the APRNs to be timely granted their licenses. We don't want to be standing in their way because of a bureaucratic snafu that doesn't have any real grounding. So I think it's very reasonable that this committee reconsider the practice, because it doesn't necessarily state that in the statutes, but really it seems we could accept the national accreditation if the staff reviews and feels that they meet criteria. I'd like some other comments or discussion from some of our other committee members.
I would be fine with the board addressing that as you suggested. The only thing I would request is that we were at least be updated on that at our meetings, just so we know what other colleges have been approved during that time.
Absolutely. And as I recall, we can look down at at our list for this time, but I think you put national accreditation is one of the criteria that we see listed already on the, so if you look, for example, on page 49 of our packets, we see that the 3 programs we're looking at today all are accredited by CCNE. So, and that certainly that standard, it would meet what we require for Kansas. So it sounds like the board staff is already doing that. It's just that mid step of having to have the committee and then the board approve. It's really more bureaucratic. Could I have a motion to change the procedure to allow the board staff to proceed with licensing applicants from out-of-school programs based upon national accreditation with a report back to the committee on, back to the committee, I guess, at the next scheduled meeting? Does that cover your needs, Carol? Mute.
I'm going to leave myself off on mute, and if you hear something in the background. We just have to make sure if that's the motion that Jill got all of that down.
Yeah, good. Would you mind repeating that?
You may have to wordsmith a little for me, Jill, but we'll try.
Okay.
Motion is made to allow the board staff to license applicants from out-of-state APRN programs that meet full accreditation, national accreditation standards. And then report the out-of-state licensure school applicants from out-of-state schools at the next APRN committee.
Okay, I got it. So who wants to make the second on that then?
I will second it.
You want to read it back to us, Jill, just to make sure we're clear on understanding what we're moving here?
Sure, I move to allow the board staff to license the applicants from out-of-state programs that meet the national accreditation standards and report back to the APRN committee at next board meeting or next committee meeting.
I think that's what we're asking. Is that what we're asking? And we have a second.
And yes.
Is there any further discussion? All in favor of the motion, say yes.
Yes.
Yes. Yes.
Any opposed? Any abstentions? Motion has carried. Thank you, Carol. I think that will help streamline our functions and make it a little easier for our APRNs. Maybe you might put a little something in the newsletter or on the Facebook page just to let folks know that we have corrected a bureaucratic issue that has caused us some difficulties in the past, and hopefully to smooth out that may affect our workforce. Who knows?
You'll make some employers happy. Let's put it that way.
I think it would make a lot of people happy these days. Okay. Requirements for accrediting agencies and criteria for APRN certification. Oh, that one's been on the agenda for a while, and I'm not sure that I recall everything that we were talking about doing that. I think we have something in the packets here, beginning on page 39.
I think there was some question at one point, what all the accrediting agencies require.
Right.
And so I believe National Council put this document together. And then on page 45, following this document, is kind of the accrediting bodies that are
Yes,
there as far
yes.
as
The various
certification.
certifications that are available. Uh-huh.
certification. Yeah.
One of the things that we will probably have to include in our rules and regs when we get ready to write those for APRNs would be what certifications are recognized by the Kansas State Board of Nursing. So what I would like to see again, and this is looking forward to that time next year, hopefully when we'll be working on writing some regs, is that those that have been approved through the national organization, we would be able to utilize that list because those have been all vetted at a national level for, you know, there are some exams out there that people can take, but they haven't been validated by national certifications that have been recognized nationally. So, you know, we don't want to get into the predicament of somebody telling us, well, I'm certified, when indeed they're not certified by somebody that we recognize. So we will need to maintain it. And the easiest way to maintain that list is not for us to reinvent the wheel and look at all of the certifying bodies, but to use a approved list such as is offered by the National Council. Is that any other comments you have on that, Carol? Do we have that straight in your mind there?
Mhm.
So again, those of you who will continue on the committee next year, please hang on to this document. We will need it. Next item is the update in certification for the national CRNA boards. That is also listed as one of the approved certifications through National Council. But in our CRNA statute somewhere says we have to approve that every so many years, as I recall, Carol. That's
We
the
do.
only one that is separated out from
Yeah.
the others, just because of how our regulations are written. So they have given us here in this next document, beginning on 47, the update to their certification program.
And this one has been also a holdover. I think maybe it was in December.
So we'll just need to have that reflected in the minutes. I believe that we have, the committee has reviewed the
Okay,
National Board of Certification and Recertification for nurse anesthetists. And I'm certainly sure none of us are going to rewrite those certifications, so we accept. We don't even need a motion on that one. Okay. New business. Here we go. Approvals for 3 universities graduates are listed there. And I believe, Jill, you have a motion for us.
yes. The motion reads, I move to approve the following out-of-state schools and their below noted programs as meeting the board's criteria. North Park University Adult NP, Otterbein University Family NP, United States University Family NP.
May I have a maker for this motion?
I will motion.
Thank you, Ben. May I have a second to the motion?
Dawn Gosnell, I'll second.
Thank you, Dawn. Any discussion? Hearing none, all in favor say yes.
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 Any opposed? Motion carries. Not the last time we'll do that, right?
Yes.
Hey, how about that? Our meetings will get shorter, right? Yes. Okay. Any items for the agenda for December committee meeting? I think we will want to hear what out-of-state programs have been approved, so we can put that on there. Certainly, we will need prescription monitoring program. We will need any update on the CNMI regulations. We'll need an update on the House Bill 2412. Anything else you can think of at this point in time, Carol or Jill?
No, I can't think of anything at this point.
There may be some regulations or something that are up for review. I'm not sure, but you'll add those as the time schedule
Yeah.
mandates. Okay. Any other business for the committee today?
Hey, Carol, if I could just
Yes.
do an update. I forgot to put this on under unfinished business, but
Oh, okay.
the healthcare stabilization
Oh, yes.
requested that we put something on our website, which we do. We have
Yes.
a link to, I believe, their frequently asked questions and then information about the healthcare stabilization that is available on our website. And then what we did is on the APRN application, we actually added in the attestation that nurse midwives and RNAs are required to participate in healthcare stabilization. So that, again, that's another way that they'll know if they're new to the state. So I believe that's what we were asked to do. And we've got that.
Exactly right. We didn't want to be responsible for telling what the stabilization board was doing, but we wanted to provide an easy link for those that are subject to that. Yes.
Yeah.
Thank you very much to you and to Adrian, or who all worked on getting that little piece fixed. Yes.
Thank you.
Yes. Yes. Okay. Any other business before the committee? Jill, do you have a final motion for us?
I sure do.
All right.
The motion reads, I move to adjourn.
May I have a maker for that motion?
I will make the motions.
Oh, Ben, you're our man today. Thank you. May I have a second?
This is Dawn.
I'll
I'll second.
Thank you. We have a second. All in favor say yes and goodbye.
Yes.
Yes.
Thank you, everybody.
Thank you.